Hi, as a part of iKure case study, we are in Sriniketan in Bolpur, which belongs to Birbhumi district in West Bengal. Here with me is Minh Vo, who is from Vietnam, who is on internship from village capital and who has been assisting iKure for the last 6 months. And his assistance largely has been in consulting in various parts of iKure. And he's going to take us through the entire journey of iKure's social enterprising model. And more interestingly, at the moment we are in a place which is called as a hub clinic of iKure, where every action takes place. And let's hear from all these people who have been on the front end of the action for the last 1 year or so, and they have been making a difference to lots of people across this city and lots of other places. Min, over to you.
Thank you, Dr. Nagendra. My name is Min, and I've been with iKure for 6 months. So in very brief language, so iKure is a social enterprise providing affordable primary care for rural eastern India using technology as a difference. Using our software, cloud technology, we established what we call a hub and spoke model. And what you see over here is a hub clinic, where is the base where the doctors are living. We open the clinic 7 days a week, and from here we send the doctors to the spoke clinic, where is nearer to the interior of the villages, and that's where the doctors will get to visit several villages in one run, and then they come back to base.
Right. Can we talk to the people who have been assisting you and your team in making sure that this hub has been running very effectively?
Sure, definitely. So I will introduce you to my colleague.
Right.
So first will be Mr. Sayan Roy. How about we enter the clinic right now?
Right. We are entering Hub Clinic, where we are going to talk to Dr. Sayan Roy and his team, who have been assisting the entire scaling of this operation. Let's go and meet and talk to them. Come, Min. Let's talk to Dr. Sayan Roy.
Good afternoon, Dr. Sayan.
Yeah, hello, how are you?
I'm good.
Hi, Dr. Sayan.
Hello, sir.
How are you?
I'm fine.
How's your team?
Yeah,
Can we have...
let me
Please,
introduce
please.
with my team.
Please.
Here is Dr. Mohammad Obaidullah,
Okay, Doctor.
Dr. Mohammad Obaidullah.
Very good.
Dr. Santanu Mukherjee,
Fine, nice to meet you.
and Dr. Majumdar.
Dr. Majumdar, nice to meet you.
And here is Sanjay, he is our clinical accountant.
Nice to meet you.
Thank you so much. Okay, can you take us through the basic foundation of your rural healthcare center?
Okay, actually this is our Surul clinic, this is our hub clinic. You can see iKure Surul RHC, Rural Healthcare Center, and what you are seeing here, it is our daily schedule.
Right.
Okay, we have the, today morning we have the Surul clinic first, that is the hub clinic, and one team went to Raipur and then Uttar Narayanpur.
Right.
It was from 8 to 12:30. That is 2 hours in Raipur and 2 hours in Uttar Narayanpur. Okay, and after in evening session we have Mohula one clinic, and in Vishnukhanda there is one medical camp. Okay, we have the roster here. We follow the roster here. Every day roster we have follow this clinical schedule. Okay.
So how does it change every now and then, or is it that it's almost
No,
fixed?
it is fixed.
Okay,
It is fixed.
and then what changes is the patients, that
Yeah.
right?
Yeah.
Very good, very good. And here is where you have all the medicines. Which you
All the
supply,
medicines.
right?
Yeah.
Very good. And these medicines, are they supplied free of cost, or is it a part of their fee that they pay?
No, yeah, it is within the fees which the patient is paying to us.
Very good.
That is 80 or 90 rupees within that. Doctor's consultation
Everything
plus
is included in
medicine.
that one. Very good, very good.
And we also use this one. This is our medicine requisition.
Right.
That is the patient name, patient ID, and this is the medicine name, the batch number, expiry date, how much medicine we are giving to the patient. That is the signature. This is the proof.
Very good.
And another one is that is our that is receipt. That is how much patient is paying. We have receipt for that one. That is the name of the clinic. Okay. Then receipt with 80 or 90. That is according to the clinic.
Right.
And it is the patient name, doctors who is treating the patient, and if there is whether any investigation charges, because we have ECG also here,
Right.
and we have the sugar monitoring system, and then we sign here and give the counterpart
Counterpart.
to the patient.
Right, very good. And in case somebody goes for this investigation charges, investigation services, etc.,
Yeah.
what would be the charge?
For the ECG we took 60 rupees, and for sugar monitoring we 30 rupees.
Very good, very good, very good. Okay, now I think Min, I think you should join us for explaining I think we keep hearing a lot about this very proprietary software that Sujay and his team have invented called as WHIMS.
Definitely.
I think that has
That
been
is
invented.
wireless health incident monitoring system.
I'm sorry, come again?
Wireless health incident monitoring system.
Wireless health incident monitoring system, which has been developed in association with, I believe, IIT Kharagpur.
Yes.
And that has been the cornerstone of iKure success, if I'm right,
Right.
which made it scalable. Right, which
right.
doesn't make you to restrict to one place, but then you can scale up this one not just to India and other parts of the India, but also the rest of the world. Am I right? So can you take us through the physical demonstration of WHIMS? How does it work and things like that? Do you have someone who can explain to us?
Sure, definitely.
And before that, maybe you can give us some ideas of what's WHIMS and the physical demonstration of that.
Sure. So for those of you familiar with ICT, information communication technologies, WHIMS is a cloud-based software. So the entire database on WHIMS is hosted on Amazon Cloud Server. So what it does is it allows us to remote monitor patients from afar. Let's say a doctor sits in a hub clinic, he can also monitor a case going on.
By the
in
way,
a spoke
I'm
clinic.
sorry to interrupt you. What's the difference between this and telemedicine?
I think this software requires a much lower bandwidth than telemedicine. Telemedicine do require, first of all, the capacity of video streaming, which is a challenge in rural area where connectivity is not the best. So it does limit the reach of the healthcare provider when you go venture further into the interior. And it's very lightweight, it's customizable, and it's scalable for that matter.
Right. So how does it work? I mean, do you sell this to hospitals, or do you sell this one to patients? How does it work?
We offer this as a fees for service.
Okay.
We sell license,
Mhm.
as in doctor logins and hospital groups. When let's say you are a healthcare provider, you have rural healthcare clinic. So we ask you how many clinics do you have, how many hospitals do you have, how many doctors, and based on that we charge you a license for using WHIMS. And so then each doctor, clinic, and hospital will have a login, and then through that WHIMS, we have a platform that can integrate the system together. So hence the doctor who sit in the hospital can monitor a case or give remote case consultation to
Right.
any patients or any secondary doctor, primary care doctor, for example, who sits in the spoke clinic. So that minimizes time travel, save costs, and improve revenue.
Right. How many months has it been since it's deployed?
In where we're standing right now is a Bolpur cluster. We started in 24th of February 2013.
13.
So for this cluster, we've been deployed for, let's do the math, 13 months.
Right.
We also have another cluster in Keshari, we call it Keshari cluster in Minapur, which is an hour of travel away from Kolkata, also in West Bengal. They have been around since November, at least November 2012. So the technology has been deployed in this business model for a year to a year and a half. Before that, we've trialed and tested this technology with a lot of CSR projects with foundations and other corporations
Right.
as well.
Right. Can we have the physical demonstration of how does it work?
Sure, definitely. So I introduced you to my colleague over here.
Sanjay.
He will
Right.
walk you through the feel and touch of WHIMS.
Okay. So Sanjay is going to explain to us how WHIMS is going to work, and like I said, it is at the cornerstone of iKure success. And this has been a proprietary software that has been developed in association with IIT Kharagpur, and it is taking iKure to places. Let's look at how it actually works. Yes, Sanjay, please.
This is our registration page,
Okay.
WHIMS registration page,
Okay.
and this is first name. This patient is Soma Mukherjee. First name is Soma. Then last name is Mukherjee. Then her age is 22 years. She is a female
Okay.
and married, and religion and Hinduism.
Okay.
Next is her address is Surul. He worked at a household worker
Okay.
at state West Bengal. Our income, yearly income, less than
20,000.
50,000. District Deveolped. The area, this area, Bolpur.
Sriniketan. Okay.
Bolpur area, police station, Bolpur.
Okay.
And pin code 731236.
Right. So this is the basic information,
Doctor's name. Select clinic. Submit.
What is this one? So this is a diagnostic clinic. No, what is this? The Ganga.
And allopathy department.
Okay,
The department is allopathy.
Mm-hmm.
Arun Muzumdar doctor.
Okay. So she's going to see Ajumdar.
Arun Muzumdar.
Okay.
Then
Okay.
and then her ID, the patient ID.
Mm-hmm. The patient ID is generated now.
132
288.
288.
Right.
And her problem is fever, cough and cold,
Okay.
and vomiting and nausea,
Nausea.
and abdomen pain.
Right.
Add new case, then add new case, general case,
Okay.
and there is fever.
Mm-hmm.
I am take this.
Okay. So right now you're going to offer all these services, right?
Yes.
So we have close to about 25, right?
25
Diseases,
diseases.
right? Very good, very good. So all these things are being referred, addressed by the local doctors here.
Local doctors.
Very good.
Headache.
Mm-hmm.
Head. This is head.
Okay.
Head. Doctor take this headache.
Okay.
I am take this
headache. Very good.
The other cases is abdomen pain.
Okay.
So this is abdomen.
Okay.
Upper abdomen.
Okay.
Pain and discomfort option.
Okay.
I will take this.
Very good. So this goes to the doctor, right? Okay.
Create prescription.
Okay.
Then create prescription.
Mm-hmm.
This is the Pansep O
Mm-hmm.
200.
Mm-hmm.
Pansep O 200.
Mm-hmm.
On tap BD 7 days.
Mm-hmm.
Then after
So from there, you can take all kinds of information from the patients at the doorstep. Once you bring the Android to wireless environment, you can.
Good. Now that we have had an introduction to what WHIMS is all about and how does it work, and largely it is a manifestation of all the information that you have had in this kind of slip, and they are catering to almost about 30 diseases, and so far it has been fantastic. Now we have with us Dr. Sayan Roy, who is going to explain to us the entire operating model. I won't say business model, but then it's operating model, how the WHIMS is integrated into the entire operating model. Now, Dr. Sayan, can you take us through what is this all about?
Actually, these steps we follow in our clinic.
Right.
That is when first patient comes to our any clinic.
Right.
When first he or she comes to our reception department. From reception department, we send the patient to the doctor's consultation in our clinic.
Right, we'll go and talk to you.
Yeah, yeah.
Very good.
Then after doctor's consultation, we took the prescription from the patient and he goes to the pharmacy department. We provide the medicine to the patient.
Right.
And after that, the billing system. I saw you previously the receipt.
The bill.
Okay. Then we have the counterpart of the prescription also.
Right.
From the counterpart we took the patient data to the WHIMS.
Right.
Okay. And here is the extra facilities which we are providing to the patient.
Right now only
That
these
is-
4 are provided.
Yeah, yeah,
BP, ECG, blood
ECG,
sugar,
blood
and
sugar and
physiotherapy.
physiotherapy service.
Very good. Good.
Okay.
So far, what is your experience? I think you've been here for last about 13 months also.
No, I am here for last 5 months.
5 months. So what is the reason? What's the most important thing that people come here with? The patients, do they come for a general checkup or do they come for any of the services?
No, mainly patients come. Actually, it is our rural health center.
Right.
We are not providing any type of emergency services.
Right.
Okay. So they are coming here for mainly general disease like cough, fever, cold, like lungs diseases.
Lungs also?
Yeah. And mainly, if you see from the physiotherapy point of view, then lots of patients are coming with the low back pain and the knee joint pain. Because mainly the rural area here is
What
maximum
is it?
patient is from their farmer
Right.
labor.
Right.
So they are suffering from the knee joint pain
Right,
and low back
right,
pain.
right.
Okay.
And have you taken any feedback from these patients as to how has been your service to them?
Yeah, actually, previously I have not with the equipment which I have given to them, prescribed to them. They are really
Very happy with that.
very happy with
Very
that.
good. Okay, now can we talk to the doctor? Now here is how the resident doctor of iKure works, and he is the one who's acts as a consultant doctor, and he's the one who takes care of the patients, who gives a consultation and who advises them what kind of medicine to take, or should he or she be referred to another hospital, etc. Now let's have one little chat with this doctor. Hi doctor, how are you? So how long have you been here, doctor?
5 months journey.
5 months journey. So how has been the experience?
বাঁকুড়া সম্মেলনী মেডিকেল কলেজ থেকে পাস করেছি 2010
Very good.
তারপরে বাড়ির কাছাকাছি ওখানেই একটা এনজিওতে করতাম কাজ ওখান থেকে কাজ ছেড়ে ওখানে কাজ বিশেষ আমার পার্সোনাল ব্যাপারে কাজ ওখানে ছেড়ে যাই ছেড়ে তারপরে আইকিউরে যখন বললো আইকিউরে এখানে ভ্যাকেন্সি যখন এখানে পেলাম এখানে জয়েন করলাম 5 মাস করলাম ভালোই লাগছে এখানে রুরালে ভালো একটা পরিষেবা চিন্তাধারা অনেক ভালো হবে
How, what has been your experience? Do you enjoy working here? Because it's completely no glamour here, right? It's no glamour like the corporate hospitals. So do you enjoy here working? And because
হ্যাঁ সবাই একটা ভালো মাল্টি স্পেশালিটি হসপিটাল পৌঁছতে পারে না হ্যাঁ সেক্ষেত্রে আমরা মানুষের পাশে থেকে মানুষের করে ভালোভাবে পরিষেবা দেওয়া
okay. So
এটাই ভালো লাগে
very good.
খুব ভালো আরও আইকিউর আরও ইনভেস্টিগেশন সেন্টার আরও প্রজেক্ট আরও বড় হলে
So can we say
আরও ভালো মানুষের পরিষেবা দেওয়া যাবে মানুষের পাশে থেকে
right.
এটাই আশা করি
So can we say Jai iKure?
Jai iKure.
Very good. Now, can you share with us one very interesting? Do you have any great experience, very poignant experience with any patient here?
মানে এরকম কোনো পেশেন্ট এক্সপেরিয়েন্স আছে যে আপনাকে ফিডব্যাক দিয়েছে খুব ভালো আপনি ট্রিটমেন্ট করেন
Somebody comes here and then you feel because his consultation, they feel so happy and he's very touched. Is there any experience?
কিছুদিন আগে একটা মনে পড়ছে কিছুদিন আগে এই জায়গায় ক্যাম্প করতে গিয়েছিলাম তা ওখানে একটা পেশেন্ট ছিল পেশেন্টটা বয়স 13 থেকে 14 বছর বয়স তা অ্যাবনর্মাল ছেলেটা এমনিতেই অ্যাবনর্মাল তা টয়লেট করে 4 থেকে 5 মাস 4 to 5 month toilet বর্ধমান মেডিকেল কলেজে ওখানেও দেখিয়েছে সবাই মোটামুটি ক্যালকাটা মেডিকেল কলেজে রেফার করে আমিও সেই অনুযায়ী ওটা সে রেফার করেছি হ্যাঁ তবু কিছু মেডিসিনও দিয়েছিলাম কিন্তু তার জাস্ট 2 থেকে 3 দিন পরে পেশেন্টটা আমার কাছে পেশেন্ট পার্টি মোটামুটি যেটা খবর জানলাম খবর পাঠালো যে পেশেন্ট আমার মেডিসিনটা খেয়ে এখন রেগুলার মানে টয়লেট করছে এবং ভালো আছে এটাই আমার কাছে গডের হতে পারে এটাই
Felt very happy.
খুব হ্যাপি
Thank you so much. Now that we have heard and seen all the facilities at Hub Clinic of iKure in this place, let's talk to Dr. Sain about all other facilities that we have in this hub clinic. Dr.
Yeah.
Sayan,
Here is our operational physiotherapy room.
Right.
You can come inside.
please.
It's our equipment here.
Okay.
Okay. We are trying to
Right.
make it as fast as possible.
It's not an operation, right?
Yeah, it's under operation.
But it will be operational.
Yeah. Within a few days, within I think 15 to 20 days, we can
Immediate
start
operation. Very
Okay.
good. Very
Here you can see our doctor's accommodation room. It is room 1. And you can come here. Here is our accommodation room number 2. Where doctors are staying here.